Dr. Kidong Park, Director of Data Strategy and Innovation of the World Health Organization, Western Pacific Regional Office, Dr. Graham Harrison, the WHO Country Representative to the Philippines, Dr. Bunsay Kidsana Yotin, Chair of the Asia eHealth Information Network and the AHIN Governing Council, and our fellow healthcare workers from the Ministries of Health, the academe, digital health experts, and our international partners who are working towards the important agenda of digital health to support universal health care. A pleasant morning to all of you. Thank you for inviting the Philippine Department of Health to this conference on accelerating digital health towards universal health coverage. I extend my warmest congratulations to all of you as you gather partners, experts, and advocates across the globe in the digital health landscape. Perhaps some of you may have already heard that our country has just recently passed the Universal Healthcare Law by virtue of the Philippine Republic Act 11223. This is one of its kind in the last 30 years given the massive reorganizing of our healthcare system through the creation of healthcare provider networks, the institutionalization of special health funds in the local government, and the expansion of network contracting mechanisms. All this will only be realized with digital health. Like many countries present today, our main healthcare system reform was disrupted by tracking down of COVID-19 outbreaks and the control of its spread. With all hands on deck, we were able to develop our case surveillance system and deploy it rapidly on a national scale. But more than resolving the ills of COVID-19, we were faced with so many entities offering their technologies and applications. This required massive coordination and harmonization, which was made possible by creating a technical working group on data governance. This technical working group developed an enterprise architecture framework approved by the government that integrated various COVID-19 systems. Moreover, we were able to mobilize not only government agencies but the private sector in providing digital health tools to combat the pandemic. COVID-19 locked down everything and restricted mobility. Thus, virtual solutions were required for people to access care. We have able to deploy telemedicine rapidly through technological approaches and innovative partnerships. We also partnered with academe in developing disease modeling platforms that were used by local governments on a daily basis in managing this pandemic. Truth be told, this process of coming together is the essence of our response. Although this came as a surprise to the public, we were able to chart our path that partnership is the right strategy for the COVID-19 response. After all, you know that COVID-19 could not be slowed down by public health interventions alone, but also the cooperation of the citizens in our prevent, detect, isolate, treat, reintegrate strategy. There were a lot of learnings during this pandemic, most especially in the use of data, all of which we hold true to our hearts until now that we bounce back to our efforts towards universal health care. So what have we learned from all of this? Time and again, when confronted with long-standing public health problems, we still work towards healthcare system reforms, and we ask ourselves, how can we leverage tools in the ground in our pursuit of healthier citizens? The answer is simple. It is not the tools in your arsenal that will make you win a goal, but the strategies you deploy. That is why today, every one of us here has met extreme challenges in our respective healthcare systems, yet we have adapted and overcame them. Today, we share with you important UHC Health Information System related policies that we have adopted. These policies set the data standards, define the integrated HIS model, which all electronic medical records now follow, and ensured healthcare workers have the data and tools for better health outcomes, a more responsive health system, and more equitable healthcare financing. In the next 3 days, my colleagues at the Knowledge Management and Information Technology Service the Epidemiology Bureau, and the Disease Prevention and Control Bureau will share their experiences in HIS strategies and reforms towards universal health care. The Philippine Department of Health is very happy to be co-organizers of this conference. I am fully aware that the Asia eHealth Information Network has been a partner of the DOH in the last 10 years in strengthening health information systems, e-health, and digital health interventions in the country. Testaments to this are professional IT certification capacity building and technical assistance provided by AHIN through the WHO, WIPRO, and other global partners. We thank you for extending your support to the National eHealth Program Management since 2012 and its work with the Philippine Health Insurance Corporation, the Department of Science and Technology, the Department of Information and Communications Technology, and the University of the Philippines, who have all participated in the AHIN's capacity building activities and technical assistance, gaining access to global experts in master facility registry, health information exchange, enterprise architecture planning, privacy and professionalization of IT manpower in the country, among others. Learning from the Mind the Gaps framework, which you launched during the AHIN General Meeting in Myanmar, has taught us that the digital health tools to support UHC rollout no longer rely on innovation, rather readiness of our large-scale IT project management. While we have instituted the Interagency National eHealth Program, we are at the brink of failure should we not organize ourselves within and outside the Ministry of Health better. We are cognizant that there are many problems beyond our control. For instance, the provision of internet connectivity is way beyond what the Ministry of Health could resolve. That is why we draw strength in the expertise of our DICT to connect our primary care healthcare facilities for data submission and reporting. Allow me to close with a personal reflection as we look to a future together with hope and expectations. There is a lot we can do together because if we want to go fast, we can go alone ourselves, but if we want to go far, let us all do this together. Thank you very much and mabuhay.